Ladies and gentlemen, on the line, we have the guy who's been on the front line, not just for COVID, man. I was doing a little bit of research, man. He was actually, schooling people on what was going on when the AIDS epidemic first popped off back in the day, too, man. And he here with us one time for Dr. Anthony Fauci.
Woo!
Yeah, good to be with you.
Likewise, man. So let's get to it, man. Omicron, we've been hearing about flu, Rona, vaccines is rising, man. What do we need to know about right now?
Well, right now, we are in the middle of a big surge of a new variant called Omicron, which has really swept throughout the entire world, originating first recognized in Southern Africa by our South African colleagues, and then it became clear it's surging throughout the world. That's the really challenging situation. Somewhat of a silver lining, if you want to call it that, in such a difficult situation, is that it's peaking very quickly and starting to come down. So in big cities such as New York City and Chicago that got hit really badly by Omicron, it peaked quickly and is starting to come down. So hopefully we'll start seeing throughout the country that we've reached the peak and we're turning around. You don't want to get complacent at all because this virus has fooled us multiple times over the last couple of years. But we want to pay attention to the fact that the vaccines clearly continue to protect you against severe disease. We know there's a lot of breakthrough infections of people who've been vaccinated and who've been boosted. But the really good news is that if you are vaccinated and boosted, although you may get a breakthrough infection, the chances of you getting severe disease requiring hospitalizations is much, much, much lower than if you're not vaccinated, which is, again, a very strong argument for why we're encouraging people who've not yet been vaccinated to get vaccinated, and those who've been vaccinated to go ahead and get boosted.
Now, you said it looks like we may have reached our peak. Now, you recently also said that the rapid spread of the Omicron variant can turn the pandemic into an endemic. Now, what's the difference between a pandemic and an endemic, and why would this happen?
Well, the definition of pandemic is a widely spreading infection, in this case a virus, that is having a major impact on society throughout the world. And the disruptions that we've seen over the last couple of years has really validated and verified that definition because we have been living through a historic pandemic. Mm-hmm. When you use the word endemic, it means that it's present in society, but generally at a low enough level that it isn't disruptive of everything we do. For example, we know that common infections that we all experience, that sometimes people get seriously ill, but for the most part, it isn't profoundly disruptive, such as influenza, parainfluenza, respiratory syncytial viruses. It's there, it's at a low level, and we know it, we try to prevent it, but it's not disruptive. So when people talk about hoping that we'll get the SARS virus, namely SARS-CoV-2 and COVID-19, to a level of endemicity means that the level is so low that you don't stress the hospital system, you don't have a lot of severely ill people. You'll have some people who get ill, but it's not going to be dominating what we do. That's what we mean by endemic, a low, persistent level as opposed to a very, very high, sustained level.
Got you. Well, with that being said, you said it's an endemic, but unfortunately, it seems like new variants are just dropping like Jordans. Every week is something new. So how do you calm the public's perception of what's real when you get vaccinated, then you need a booster, and then another variant comes out, and then you might need another booster? So how do you get people to understand that doing this is actually going to improve the situation that we're going through now?
Well, it definitely will improve. I think we need to look historically that many of the vaccinations that you and I have had as children to protect us from measles, from polio, often those were multiple injections or multiple administrations of vaccines. It wasn't only one. And even with common diseases like measles, mumps, rubella, and others, that not infrequently after a period of time, you might need a boost to bring back up the strength of the response. So there's nothing really particularly unusual about that. We're in the middle of a very stressful pandemic right now, and people understandably are wondering where is all this going, where we're going to be. You just need to look at the facts. The things that we do know is that when you compare diseases that are serious enough to cause hospitalization and death, and look at the difference between an unvaccinated person and a vaccinated person, with COVID-19, an unvaccinated person is 10 times more likely to get infected, 17 times more likely to be hospitalized, and 20 times more likely to die from COVID-19 than is someone who's actually vaccinated and boosted. And that's the reason why, despite all the stress and the pushback about getting vaccinated, we know now, after giving throughout the world billions of doses of vaccines, that they are highly effective against severe disease. And people get confused because they say, well, wait a minute, we're hearing about people who've gotten vaccinated and boosted, and yet they've still gotten infected. Yes,
Right.
but for the most part, those infections are very mild. They are either without symptoms and they just test positive, or for the most part, they have mild symptoms. So that's, I think, an understandably confusing thing that people got to realize, that vaccines are certainly not going to 100% protect you from getting infected, but it will go a very, very long way to prevent you from getting seriously ill and sick. That's the reason why we stress so strongly why it's important for people to be vaccinated.
Gotcha. Now, Dr. Fauci, before we go, I mean, I know, diseases and the study of diseases has been your life's work. In your honest, genuine, expert opinion, what does 2024 look like? Are we still going to be in a similar space and place?
What about 23?
Yeah, I mean, he's being realistic.
We're going to watch
being
that.
realistic.
I feel like
and
we're
watch
gonna
it on
watch
home.
it.
Dr. Fauci.
What is 2024 looking like, Dr. Fauci?
Well, you're jumping way ahead. Let's
Thank
go to
you.
2022 and 2023 first before we start talking about 2024. I mean, I would hope that this certainly will be way behind us in the rearview mirror by 2024. I'm hoping that as we get more people vaccinated and people who get infected and recover will have a degree of protection, that as we get into 2022, that we see the peak of Omicron, that it comes down, and that it gets to that low level of endemicity that we just discussed a moment ago. That's the best case scenario. But we must be realistic. We've got to at least prepare for what might be a worst case scenario, that another variant might come along. But the one thing we do know, that even when you get new variants, if you get vaccinated and boosted, the degree of protection against significant disease is really quite good. And that's the reason why when you look at hospitals and you look at people who severely get involved in the sense of illness, it's much, much more weighted heavily towards the unvaccinated. So I look forward with cautious optimism that as we get into 2022, it's not going to disappear, guys. It's just not, because that's the nature of this virus. We're not going to eradicate it. We've only eradicated one virus in public health history, and that's smallpox. And we did that with a very, very extensive vaccine program. You can eliminate viruses the way we've done with polio and measles in this country, again, mostly by vaccination. But there are other viruses that hang around at a low level, don't cause disruption, and actually you can live with it, as it were. We're at too high a level right now of infection to accept where we are now as the status quo, because, we have 800,000 new infections a day. We have 156,000 people in the hospital, and we have 2,000 deaths per day. That's not an acceptable level. We've got to get it lower, and that's where I hope we'll be as we get into the coming months of 2022.
We hear a lot of people talking about consequences for the unvaccinated. Do you agree with that, like people losing their jobs or not able to go to certain businesses or establishments?
We would really hope that people would voluntarily get vaccinated, understand the importance for their own health, for that of their families, as well as what I consider, the community responsibility that you have to be a part of the solution. Because if you get infected many people say, well, I'm invulnerable. I'm not going to really get sick. Well, there's a lot of people who thought that and then wound up in a hospital. Also, you can spread the infection to someone else. And even though you may not get seriously ill, you might spread it to a loved one, a family member, or a friend, a neighbor who might be elderly or who might have an underlying condition to make them more vulnerable to a severe disease. So there's a lot of reasons to voluntarily do it. I certainly would prefer that we don't have things that require it, that people do it on their own accord.
Right.
Well, Doc, what do you say about the asymptomatic people who are vaccinated, who can get it and kind of move around without?
Yeah, I mean, that's one of the reasons why you have other interventions. Vaccines are not the entire solution to this. Vaccines are not. Vaccines are an important part of it. But that's why you hear the CDC and me and my colleagues who are public health people talk about the importance of when you are indoors in a congregate setting, even if you are vaccinated, to wear a mask, because you yourself may have an asymptomatic infection and inadvertently spread it to someone, or there may be people in that indoor setting who are infected, don't know it, they're not acting like they're sick, but they're spreading it. So mask is one. The other one is testing. And that's the reason why, just a couple of days ago, the president launched a very massive program to get up to 1 billion tests out there that are free tests in the next month or so, starting from a few days ago when the beginning of a tranche of 500 million tests are going to be distributed. And now you can go online and get tests delivered to your own home. So it's testing, prudent behavior like masking indoors, and importantly, get vaccinated. But it isn't just vaccination alone.
Recently, Dr. Fauci, the CDC recently changed the quarantine period from 14 days to 5 days. And I was wondering what happened to the other 9 days? Like, why is that able to just happen like that? You know what I mean?
Good question. Good question. And I think it's important to explain the reason for that. There were so many people in society who were getting infected but didn't have any symptoms, but they were pulled out of critical jobs, including healthcare workers, doctors, and nurses, people with critical jobs in society, people who are in law enforcement, firefighters, people who supply food to the community. We were having such a high rate of infection, even people who had asymptomatic, namely infection with no symptoms. There were so many people that were being pulled out of society that was felt you had to balance the risk of what happens after 5 days versus making sure society functions well. And it is based on science, because if you look at the durability of the time when you're more likely to spread infection to someone else, that risk dramatically diminishes after the day 5. So you're at the greatest risk of spreading it to someone else between the first time you notice the symptoms and 5 days later. But as you get to day 6, 7, 8, 9, the chances of spreading it is much, much lower. And that's the reason why the CDC says that when you get to that day 5 and you feel good, you have no symptoms, you can go out and function in society, but make sure you very carefully and meticulously wear a mask. And that's the thing you got to concentrate. They're not saying just go out and don't worry about it. They're saying go out, do your job, particularly if you have a critical job for society, but keep a mask on. And if you do that, the risk of spreading it to other people is really very low.
Gotcha. Yo, Dr. Anthony Fauci, such a wealth of information, man. Thank you for taking time to pull up on us this morning. If people want to go, check up on details and information on a regular basis, where can they go?
It's very easy. It's cdc.gov. They have a search engine there. You can just type in the question you have, and it'll lead you to the right place on the online service.
There it is. Yo, once this is all over, Dr. Fauci, you should apply for the host of Jeopardy. You know your stuff.
Oh, that would be a good idea.
Like, why
oh, my
not, right?
God. Why don't you do that, Dr. Fauci?
All right, well, I got a pretty important thing I need to do right now. Let's take one thing at a time.
Get out of here.
Right.
I'm kind of
Keep a mask on.
Yeah.
Bless up, man. Appreciate your time, brother.
All right, take care. Thanks. Good to be with you. Take care. Stay safe.
You too.
We are the Morning Hustle.